million children as a measles outbreak spreads across the country.
And the health ministry has reported 17 confirmed deaths, with more than 100 others suspected to be linked to measles. There are more than 7,500 suspected infections nationwide. The virus has been detected in 56 of Bangladesh's 64 districts.
Now, the immunization program will run daily in 30 high-risk sub-districts from 10 a.m. to 5 p.m. local time. The priority is given to children aged 6 months to 5 years, especially those who have missed routine jabs and face the highest risk of severe complications.
And Bangladesh has made significant advancements in tackling infectious diseases with vaccinations, but UNICEF says that small disruptions can lead to immunity gaps over time. A measles drive due in June 2024 was delayed by the deadly uprising that led to the ouster of the then Prime Minister Sheikh Hasina.
We're joined by Dr. Amish Adalja, Senior Scholar at Johns Hopkins Center for Health Security. Thank you so much for joining us. Is this outbreak, and how concerning is this from a public health perspective?
From the perspective of Bangladesh, this is an outbreak that needs to be controlled. It is very serious, and we can expect those numbers to go up because many of the cases are not diagnosed, including those that are fatal. So this is likely an underrepresentation of what's going on in Bangladesh, and this is something that they need to get a handle on because measles is the most contagious infectious disease that we know of. And if you have a population that is very susceptible, and by some statistics, there's less than 60% of the population is vaccinated against measles, this will be able to spread like wildfire and put a lot of stress on already stressed healthcare systems or healthcare facilities in Bangladesh.
And Doctor, the country is now turning to mass immunization. What actually moves the needle faster in this case? Is it blanket nationwide campaigns or highly targeted interventions in high-risk communities?
So it's a little bit of both. You want to make sure that everybody is getting vaccinated or has access to the vaccine. But to staunch the outbreak now, you want to go to the most highly impacted districts where the infections are being driven and make sure that those populations where the most cases are have the highest amount of vaccination. So you want to sort of do both at the same time. It's very challenging to do, so targeted, as well as make sure that you're not getting behind in other parts of the country so it doesn't spread to other districts that don't have cases yet.
And I know it's early days, but what would be the initial indicators that this vaccination drive is actually bending the curve? What should authorities look out for?
You would see the number of cases being reported going down, the number of hospitalizations going down. So it's going to take some time to be able to see that number, but that's what the indication would be.
The understanding is that this outbreak follows disruptions to routine immunization after their political unrest. I wonder how quickly can immunity gaps build up, and how big a role do these sort of disruptions play in outbreaks like this?
Measles, as I said, is the most contagious infectious disease, which means that you have to have a very high level of immunity in the population, 95% or above. So even what looks like a mild disruption can get that number below 95%, and that virus will find those individuals who are not immune and infect them and cause outbreaks. So this is something that you have to be really proactive with, and you can't allow kind of any backsliding or you will see measles recur.
Okay, understood. Beyond Bangladesh, Doctor, we are seeing similar spikes in wealthy cities like London and parts of the U.S. Why is it resurfacing in some high-income countries, too?
So this is the opposite issue. We've not had a major disruption. What we've had is the rise of the anti-vaccine movement and people willingly choosing not to be vaccinated, especially in the United States. So this is something that is harder to deal with in the sense that the solution is available in London, the solution is available in the United States, but we have an anti-vaccine person that is now running the Health and Human Services Department of the United States, that's RFK Jr., and we have the anti-vaccine movement really spreading disinformation. People have turned away from the vaccine, and that's why we're having this problem in the United States. Very different than the problem that they're having in Bangladesh.
Actually, in your opinion, what's the best way to treat misinformation in this case?
I think you have to call it out. You have to say that this is misinformation, this is disinformation, and you have to point people to the data, to trusted sources. But it's very difficult to do, especially if you're doing it when you're on television or radio. You need primary care doctors to talk to their patients about this. And it's a very difficult task. And we've lost so much trust in the United States because of the COVID pandemic and all of the politicization of infectious disease that I don't know how we come back from this. And I think the U.S. will likely lose its elimination status for measles later this year.
Doctor, you talked about how contagious measles is. You've mentioned it twice. I just want to know that how likely would that be then that other Asian countries close to Bangladesh could see similar outbreaks in the coming months? And if so, which countries do you suppose, or which settings would be most concerned right now?
You have to remember that measles is endemic in many Asian countries. So just near Bangladesh is India, for example, they have endemic measles. So all of those bordering countries are going to have the same problems because no place in the world had eliminated measles except for the region of the Americas. And now that's gone because Canada lost its elimination status. So measles continues to kill tens of thousands of children every year. So I do think that we are going to see a banner year for measles all over the world. And any of the countries that are in that region where vaccination rates have fallen are going to be at risk because they never eliminated measles. So it's not as if they have to get imported cases from Bangladesh. They have their own homegrown cases that will find unvaccinated individuals in their countries and spread. And if you look, countries like India do have high numbers of cases as well. And then in Southeast Asia, Indonesia has many cases as well.
So along with vaccinations, what are the most urgent steps that health authorities need to take right now to stop this from escalating? And for average person watching, what are the key things that people should be doing?
Well, the solution is actually the vaccine. That is the main thing that you need to do. This was a problem that was solved in the 1960s with the development of the vaccine. It's just that the vaccine hasn't reached all the corners of the globe. And then there are anti-vaccine advocates that have eroded some of that. So it's really about getting the vaccine into people, making sure that health facilities have the ability to diagnose measles and to treat measles and make sure that they have the capacity, the healthcare workers to be able to do that. That's also going to be important. And then a lot of this is going to be education. So if people have measles, they need to isolate themselves. They need to have public health infrastructure to be able to contact trace and make sure that those people who are exposed know that they were exposed. So there is a lot that the health system can do. But the primary focus has to be getting vaccine into the arms of the unvaccinated.
And Dr. Adalja, if we were to look ahead 6 to 12 months in advance, are we looking at a risk of a broader global resurgence of measles? And what will determine which way this goes?
I do think that's almost a foregone conclusion, just based on what's happening in North America right now, that's a harbinger of what to see globally when it comes to measles. And I think what we'll notice is that measles will become endemic in many countries that might have had it under control. We will see the number of measles deaths rise from 95,000. We had 3 measles deaths in the United States last year. That's unheard of. And we'll just see more and more backsliding and a catch-up game to try and get more measles vaccine into people. And this is going to be very disruptive for healthcare facilities because they're going to have to take care of many of these measles cases that could have been prevented were vaccination rates higher.
We appreciate your insight. Thank you so much, Dr. Amish Adalja, who's Senior Scholar, Johns Hopkins Center for Health Security. Thank you.